Welcome to Brutal Honesty. I'm Nick Rowley. Today we're going to be talking about medical malpractice, which is the third leading cause of death in America. So what is medical malpractice? Medical malpractice is when a healthcare provider or a healthcare institution does not deliver the level of care to a patient that patient deserves. The healthcare system, as we know it in America, is a money-based system. Nobody's out there practicing medicine for free. Maybe there are some pro bono, clinics here and there, but this is a money system. The corporatization of medicine has decreased the level of the standard of care in every state in this country. We have more patients being hurt, maimed, and killed by medical malpractice than ever before. And it's because the corporations and the insurance companies are taking over and taking away the individual decision-making power that physicians and healthcare providers have. They're taking physician assistants and nurse practitioners who serve very important roles, but they're putting them in positions where an actual physician should be doing that work. You have physician assistants who are running clinics all on their own without any supervising physician. In fact, you have a supervising physician on paper who's in some other state. And that physician assistant is supposed to be delivering the level of care that a trained physician, a board-certified physician, would be delivering him. The only difference is that the physician assistant has 2 years of education, training, and experience versus the physician who has 10 to 12 years. So this is what's going on. Bringing awareness to medical malpractice and the death rates is very important if we are going to effectuate change and if we are going to save patients and save patients' lives. So bringing these cases is the way that we effectuate change as trial lawyers. What we have going on in our country is we have the insurance industry that has put together these teams in different states of medical associations, lobbyists, different healthcare providers who go to politicians to get laws put in place to restrict the rights of healthcare patients, to prevent healthcare patients from bringing these lawsuits. And why are they doing this? It's not to make healthcare better. It's to make things easier for the insurance companies. And it's to make things easier for the big corporations that are coming in and taking control of healthcare and that are lowering the standard of care that patients end up receiving. So we need to stand up and fight against that. And the way we do that is by talking to our legislators, talking to our lawmakers, and making sure that they know that putting these laws in place is wrong. Putting these laws in place that restrict the rights of healthcare patients, that limit and cap non-economic damages, only serve to drive the quality of healthcare and the standard of care down because accountability is decreased. And the only entities that benefit are the rich corporations and insurance companies. Other than that, these laws hurt everybody else. So it's important, if you have a medical malpractice case, that you pursue it. It's also important that if you have a case or a lawyer has a case that doesn't have merit, that those cases not be pursued, because frivolous lawsuits serve no purpose other than to create chaos and resentment between healthcare providers and the legal profession, whereas they should be working together to increase the quality of care. Healthcare providers have an obligation to properly diagnose patients, to give them the proper treatment and the proper medicine, and to make sure that patients get the right follow-up or get the right referrals, and they're paid to do that job. If they fail to do that job and a person doesn't get the right diagnosis, then that person can end up really sick or even dying. That person can end up spreading that illness to other people. It's very important that patients get the care and the attention that they deserve. Sadly, in our country, patients are getting less and less of that. Pursuing medical malpractice cases is a righteous thing to do. It's an important thing to do if we're going to ensure that the quality of our health care remains where it should be. We can't let it drop. It's our duty, it's our obligation to make sure that there is accountability in the healthcare system, because the medical board isn't doing it. And the healthcare professionals are not policing themselves. That's why we have civil lawsuits. That's where we can make things right. And that's where an individual can stand on equal footing against an insurance company, against a medical corporation, or some big medical group or hospital. The civil lawsuit is the place where you can do that. And there are lawyers out there who can help people get that equal footing and take something awful that's happened and take a tragedy and find some justice and some accountability and make sure that it doesn't happen to anybody else.